People who were not fully vaccinated were 5 times more likely to get infected this spring and summer compared to those who were vaccinated.
That's according to a new report from the Centers for Disease Control and Prevention. The study also found that unvaccinated people were 10 times more likely to be hospitalized from COVID-19 and 11 times more likely to die from the virus.
Monument Health's latest update on hospitalizations also shows the importance of getting the vaccine. Right now, there are 77 coronavirus patients in Monument Health hospitals. Nearly 82% of those patients are not vaccinated. Most of the patients in the ICU and on ventilators are also unvaccinated.
Well, the rate is even higher at Sanford Health, where nearly 94% of the people hospitalized for COVID-19 are not vaccinated.
So far, the hospitalization rates in the Sioux Falls area are holding steady to what they were last week ahead of the Labor Day weekend. But area doctors are already bracing for a potential surge in the coming days.
Both Sanford and Avera are seeing an increase in COVID-19 activity right now.
What we see in the clinic is increasing number of phone calls, patients reaching out with symptoms that would be consistent with COVID, and our testing rates are up.
Avera is once again considering opening a COVID testing center. Sanford reopened its drive-through testing clinic at the sports complex Tuesday, where traffic continues to pick up days after the holiday weekend.
What we seem to know now about the Delta variant is that the rapidity with which it spreads and transmits is greater.
During last year's fall COVID surge, 2 weeks was a typical wait time between a mass exposure event to cases showing up in the clinic. With Delta, symptoms are showing up sooner.
Maybe that 7 to 10 days versus 2 to 3 weeks.
Whether it's more kids going back to school, Labor Day weekend, you're going to start to see an increase in cases probably within a week.
As the number of positive cases increases, doctors say more hospitalizations will soon follow.
So we're still doing okay from a bed standpoint.
Both hospitals say whether a patient is sick with COVID or another medical emergency, they won't be turned away, but it may take longer to receive care.
The speed with which that happens and the process with which that happens may look different from day to day.
And it's not just a matter of running out of space, but also hands.
We can physically have beds, but we need to have staffing available to provide care for patients that would go into those beds.
To ease the strain on healthcare workers, doctors say they need everyone's help.
The big ask for the community and everybody is to do what they can right now to mitigate COVID and the potential surge that we're expecting to see, so we're not in a more dire situation.
Both Avera and Sanford say the best way to ease the strain on the healthcare system is to get vaccinated. As of this morning's update from the state health department, nearly 63% of South Dakotans who are eligible to receive a vaccine have gotten at least 1 dose. More than 57% have completed their vaccinations. Both health systems say they've seen a slight increase in vaccinations this week, but they hope to see a more dramatic increase soon.